Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is the CEO of Gozio Health, Joshua Titus. How are you today?
Jared, thank you for having me. Happy to be here.
Excited to have you. Let's dive right in. Tell the audience a little bit about yourself.
I'm Joshua Titus. I'm the CEO and founder of Gozio Health. I have a background in technology. Myself and my co-founders were technologists out in Silicon Valley for decades, and then decided to take those skills, that technical toolbox that we had built, and see if we can solve some juicy problems in healthcare. And there's lots of them to solve, it turns out.
And for the audience that maybe doesn't, I'm sure most people know of Gozio Health now, but let's assume there are some people that still don't.
Sure.
Give them a high-level overview of where the company is at today.
Yeah, essentially what Gozio has done is we've decided to focus on how do you get people to engage with their healthcare systems via mobile devices. And we do it in every other walk of life. Jared, if I said, let's grab some coffee, you and I are likely going to pick up a phone, figure out where the nearest coffee shop is nearby, and then off we go, right? So our phones are problem-solving companions. But healthcare was seemingly a decade behind in terms of how do you actually engage or create an experience that people want to engage with. And so we've sort of solved that riddle. We routinely go from a system having maybe 10 users a day on their mobile app to 10,000. And so getting people to engage in mass with their healthcare system is what we've solved. And that's what we do. We're in about 250 hospitals now in terms of the being the center of their mobile strategy and engaging patients and visitors on mobile devices.
And describe to me the state of mobile app development in today's health systems and kind of an add-on challenges and opportunities that presents.
Yeah, it's really interesting. We did a survey about a year ago, and what came out of it was about 9 out of 10 healthcare execs think they're doing a really great job with their mobile app that they've developed and deployed in their digital strategy in general. What's interesting is that while they feel like they're doing a pretty good job, and most of these are just patient portals, something from the website that they've made look okay on a mobile device. When you actually talk to the patients, very few of them think they're doing a good job. So there's a little bit of a gulf there between the two that we really find interesting. And when we ask to our prospects, why do you think you're doing a good job here? They don't know, or they'll point to the portal usage. And so it's really interesting. We think that there's a huge opportunity here to bridge that gap between them with a native mobile experience. And in the systems where we are deployed, we see that happening, where you just get tons of utilization, which is by my measure, the way that you're being successful. Really cool tech, but if no one uses it, kind of who cares, right? So when we have those high usage numbers, we know that we're doing something right. Always room for improvement, but we're really happy with how we're able to, again, bridge that gap. They know they need to offer it. How do you do it? Maybe that's not in the hospital's DNA. So helping them through that is what we're doing today. And so in terms of state of, I think the open platforms, the ones that play well together, are going to be the ones who win. And that's what we see a lot of consolidation right now in the industry.
And how would you say Gozio Health's approach to improving mobile usage? Like how is your approach improving mobile app usage and patient engagement? And if possible, can you give us some examples here today?
Yeah. So what we found is that when you have all these disparate data sources inside your healthcare system, maybe you got availability and you have wait time and you have all these different digital resources, that's great. But until you put them together with sort of a homogeneous user experience, you're not going to get the utilization that you want. So for instance, by putting everything in one spot, we suddenly see we reach this critical mass where the numbers just go through the roof. If you look at patient portals, for instance, you typically get 20 to 30% of people reusing that. You might use it once, but you're one and done. Whereas when we look at our users, where we've used native mobile experience, we have 70 to 85% reuse rates, like 3 to 4 times higher than what you would get with just a portal. So again, we're looking at the actual numbers to know we're doing it right. And I think putting all those digital resources in a single spot, and also we add a wayfinding component where you get this hand-holding experience from home to parking to point of care. Again, that's by itself 20% of the value, but when you combine that with the other pieces, suddenly you reach that tipping point or that critical mass where, again, the numbers just go as a hockey stick.
Talk me through a little bit, Josh, around you have a new marketplace that you recently launched. Tell us a bit about that and the value that you see that bringing to health systems.
Yeah, thank you for mentioning that. We sort of view ourselves as the Switzerland here in terms of we're agnostic to different vendors, but we do have some that we think have similar DNA to us, and that they put the client in the center of what they do. And so we've created a marketplace, and on that marketplace, other vendors who bring value in certain areas, but not in the entire thing, will plug into our platform. So we have an open platform. So Hyra, for instance, have an amazing AI chatbot. It plugs right into our platform so that you get that same experience that you might get on a website or elsewhere. Now you have it in the palm of your hand on mobile. So basically, the approach is to allow the healthcare system to choose their best in class point solutions, the best thing for availability, the best for scheduling, the best for whatever their EHR is, they get to select, and then you take those best of solutions and they all plug into our framework, to that base platform. And so that is our approach. We think it's flexible. It is open. You can write your own module on top of it if there's something new that you want to do. And so when you are open like that and you give the client the choice of who they want, naturally some names keep coming up and who gets plugged in here. And those are the ones that you'll see in our marketplace, ones that we routinely hear good things about and have a similar outlook in terms of client first, and sort of a similar DNA, I guess you could say, with Gozio.
I guess, is there anything that that's really exciting, by the way, for you and the team, into health systems? In terms of, I can't not bring this up again since we have you on.
Yeah.
Uh, can you share anything, as any advice or any best practices as it relates to mobile app design and deployment with our audience today?
Yeah, for design, that's really straightforward. Just focus on the end user, right? Think about, would I actually use this myself? Does this make sense? The good news, the positive thing about sort of playing catch up here, as we're doing in healthcare, is that you can cheat off homework of everyone who's figured this out ahead of us, right? We have Open Table, we have Yelp, we have Google Maps. We know what the end user expects. Just how do we meet those expectations in healthcare? So we, in some ways, get to choose the best in class of previous solutions that we use every day on our phones, for instance, in my case, and apply those to the specifics of being a patient or being a visitor at one of these systems. So I'd say focus on the end user, and you'll be fine. As far as deployment goes, the thing that we're seeing that I would warn against is, as my team calls it, an omni suite of mediocrity. In other words, the promise from some large vendors out there that, hey, we're going to do everything, just wait, right? There's a nice PowerPoint that looks good, and this thing never comes. Or these features come, but they are in the distant future. And when they do show up, they're not quite what you want. So I would warn against, basically waiting for the cavalry to come over the hill with everything you need in one spot, right? Until that happens, let's say that it might happen someday. I doubt it, but maybe. Pick the point solutions that you feel work the best, that others are using, and plug them into a platform like Gozio. So I said that omni suite of mediocrity is a red flag when I hear about it.
I love that. I love that phrase. Josh, what are some of the exciting things that you're working on at Gozio, or that you're focusing on right now, that you're looking forward as time progresses?
Jared, I'm sure you hear it too. We attend many conferences focused on patient experience. And over the last year and a half, when we ask, what's setting your hair on fire? What are the problems that you're facing today? We hear a little bit about patient experience, but by the second sentence, it's always, Josh, what's killing us today is staffing. Staffing and the problems around staffing and burnout and attrition. This is the biggest problem that we're facing today. So what I am super excited about is that we have, we cracked the code on how to get lots of patients and visitors to engage. And we're taking that same sort of know-how and platform and focusing now on staff, specifically staff engagement, staff benefits utilization, and focusing on burnout and attrition and helping to reduce that in healthcare. I feel like, we got into this to try to solve juicy problems. This is one of the biggest ones facing healthcare today that we can tell. And I think that mobile and having staff that are better engaged, that get feedback from patients and visitors in terms of how they're doing, accolades, this type of thing can definitely contribute towards reduced attrition, reduced burnout. We have one client, for instance, that shared that from hiring until the 90-day mark, they're losing 30% of the folks that they've signed up, right? That's a huge, huge issue. So if we can help with that by keeping that person engaged and understanding where they might be taking an exit ramp and helping them through that, it's a huge help to the systems that we serve, and to healthcare in general. So we're super excited about focusing on staff.
Well, Josh, I'm really excited to continue the conversation with you and stay in touch. And we'll have to have you come back on. Maybe we'll get you on a panel as well, and we can dive even deeper. But I know our audience appreciates you coming on today and sharing your story and giving us some updates around Gozio.
Jared, thank you for inviting me to be here. I'm happy to be here. Thank you.